you get that email I sent him, or?
Yeah, with his
Just about, yeah.
proclamation?
Yeah, yeah.
I got it.
Great.
I got it.
Just make sure it came through. Thanks.
How you doing?
Good.
You and Commissioner Edwards were talking about recommendations. I forwarded what the recommendations from her by email. Just wanted to give you a heads up and let you know if y'all want to consider that. I didn't want to mention it during the
That'll work.
anything like that. So
Oh, so I don't forget it.
Sure. Oh, yeah. Great. Is Tal back?
Yeah, let me go. He's on his way.
just for namely the public comment stuff. But then I want to get things of that nature.
Do we have a lot of comment?
We got 31 for Pratt and Whitney. I think we got 4 for family medical leave, and we then have like maybe 4 for general comments. But it's in your packet. I'm gonna give you a list of all the information. There's a list of all the people that registered. I don't know if they're ready to speak.
Okay, these are going to be phone calls, right?
Yes, yes.
Okay, but we have 31 phone calls for Pratt and Whitney.
At least, yeah, 31.
Nice.
Did we say that we're only going to go for an hour, or did we?
Well, that was the thing that I wanted to talk to you about. Max needed to know that was gonna be your stance, because he was gonna have to tell some people that they wouldn't be able to make it, because the hour would not suffice for us to
Okay.
get every comment.
Adopted policy, an hour?
No, it's not.
Isn't it? Okay.
It's what.
I think we should talk about it at this meeting. Should we just decide?
So I'm going to give you that sheet so you can at least
Not
see.
today.
if you have a
We'll be
reference.
here
Give
this
me one.
evening. I met Tom before,
Oh, you have met him?
and I met Dan's bosses along the way when we were having, but I haven't met him. Just sent you an email.
So they grouped off the bottom where it's, I think it's 31, is it 31?
Mm-hmm.
So that's grouped in that, then it's the family medical leave, and then it's the general, I think.
But the expectation is that they're all going to call in.
That's what they registered
Okay,
for.
all right, thanks. All right, commissioners and everyone who's here, I think we're ready to get started. So let's call this meeting to order. Let's review our agenda for the briefing meeting. We're going to get an update on COVID-19. And Stacy Saunders and Fletch Tove are going to help us with that, possibly others. We're going to transparency update with Matthew Baker and just have a discussion about the Upward Mobility Grant. Rachel Nygaard will help us with that. The one other item I'd like to maybe have just some discussion about after those is to check in about our public comment process for our regular meeting tonight. We have, Lamar just shared that we have a pretty significant number of people who have signed up. So I just would like to talk about it and make sure we're all on the same page about that. So is there anything else that anyone would like to have on the agenda for our briefing meeting today? All right, well, we'll consider that our agenda then. So let's get started with the COVID-19 update.
Good afternoon.
Good afternoon.
So just a reminder for folks, we did change the format of our community briefings, and so our community briefings and the briefings to the county commissioners happen in the same space, which is now. And so if you will allow, I'll do the data update, and then we do have a community message as well. And so I'll ask if you'll, thank you so much. Okay. Thank you, sir. It was. So our key messages today, as I said, are to go over the current situational report for COVID-19. Since starting to use our metrics, it's going to look a little different today with less of the charts and graphs that we've been traditionally showing you. Then go into a community message regarding Thanksgiving and holiday recommendations. Continue to talk through the social distancing pieces and also flu recommendations. So I want to start off with just the national perspective. And this map is indicating the new cases per 100,000 as of November 15th. And so you can see significant acceleration of cases within our within the nation, with many of that, with much of that red, very dark intensity being in the Midwest. And rural areas in our nation are seeing the highest rates of spread in their communities. And currently over 11.2 million cumulative cases of COVID have been confirmed in the U.S. since the pandemic start. And currently, I guess in the last week, we've been adding about 100,000 new cases per day nationally. From a state perspective, much like the U.S., there have been increased cases over the last week or so, and as of November 17th, North Carolina has a cumulative case count of 317,495 confirmed cases since the start, with 4,852 COVID-related deaths. North Carolina continues to see increased daily cases throughout the past week, with our percent positivity continuing to increase most quickly in our rural communities as well, so mimicking much what we see at a national level. Much of that spread, when we look at the state trends, much of that spread is associated with small social gatherings, get-togethers, particularly between friends and families, which is not that different from our local experience. And then at a local level, you'll recall that just a couple weeks ago, we started to introduce these local metrics based on some of the White House Task Force metrics, which are also used in many of the other slides that I just showed. And after a week of very stable trends, we have experienced an increase in cases per 100,000 in the last couple of days. We are experiencing, two significant clusters, including one at an area prison, that are contributing to the increase, but not solely responsible for all of the increase. And we saw an increase in our percent positivity in the last week. And so just a reminder, the new cases per 100,000 population per week, last week that was at about 84, and as I said, that remained stable all last week, ranging from about 80 to 90 on average. And then that changed significantly come Sunday, when we started to see about 60 new cases per day in our local health department workflow. The diagnostic test result positivity rate, which is that percent positivity, that has changed. That's slightly gone up. The last week that was about 3.7, and now we're looking at 4.0, which is still below the desired 5%, but does indicate an increase since last week's look. Our testing data, which is the next indicator, has increased significantly. Last week, that was just over 2,000 tests, diagnostic tests per 100,000 population. This week, we were almost at 2,300. And just a reminder that we've seen that weekly testing trend increase since the summer, where we were seeing a little over 4,000 tests per week in the community, and now on average for the last 6 weeks, it's been well over 5,800, getting closer to 6,000 tests per week on average. The deaths per 100,000 remains stable. That did not change, and our hospital data remains stable. So the governor, you might recall that when we started to introduce this metric too, we talked about if we have certain in 5 or more in the whole table, we would be bringing recommendations to you. If we had 3 or more in that section 1, we'd be bringing recommendations to you, or if our hospital data was in the orange or red, we'd be bringing recommendations to you. So given that the governor just recently reduced the indoor mass gathering limit to 10, that would have been our initial recommendation for restrictions, given the metrics that you are seeing. And as I said, the governor just recently did that. That reduction in gatherings went into effect November 13th, to just a couple of days ago. Other recommendations that I'll be talking through today will include Thanksgiving festivities, including limiting those to only households obtaining testing prior to attending or traveling for a holiday, and self-quarantining before and after attending a gathering. And this will be in addition to our regular 3W recommendations that we consistently talk through. And just wanted to inform you that if 3 or more of our metrics in section 1 remain red or orange, or if we have additional change, additional restrictions may be needed and will be discussed at our next update. So watching this one, given that the governor has already reduced that indoor gathering. I'd like to go into more detail about the recommendations for the holiday festivities, and this is where I kind of like to change the style a little bit and go from the data to more that community briefing style, if I may. And I'd like to deliver that community briefing type of address for the community as a whole. And so just to summarize for folks, our nation and our state have been experiencing high rates of viral transmission in the last week. This has resulted in record daily case counts for both our country and our state. To date, the United States has experienced over 11 million confirmed cases since the pandemic start, and almost 250,000 deaths related to COVID-19. Our state currently has experienced over 317,000 confirmed cases since identifying our first North Carolina case. And sadly, almost 5,000 of our fellow North Carolinians have died related to COVID-19. Here in Buncombe, we are on the brink of reaching 5,000 cumulative cases in our county. We are just under that today, with over 100 of our neighbors having died related to COVID-19. Contact tracing locally tells us that family get-togethers and social gatherings and places of work are sites of potential spread and exposure. And so I just want to remind folks that please remember that the 3 W's must be followed all the time in order for it to work. This means with your family, your friends, and your coworkers, which means also at dinner with neighbors, at church, and in the break room. We have to be following the 3 W's. And as we embark on what starts our traditional holiday season, I want us to remember all of those who have been infected and affected by COVID-19. I want us to remember that this holiday there are some of our neighbors that will be missing someone special to them because of COVID-19. And as we enter this season, please remember that every interaction, even those with your family, is an opportunity for the virus to spread. Our local indicators are on the rise. The things we do or don't do matter. Our future trends and decisions lie in the hands of each other, and every community member. So please remember that washing our hands, wearing a mask, and keeping 6 feet apart with anyone outside our immediate household, and that means people we know but who are not in our household, is very important. And please remember to get the flu vaccine. Protecting ourselves against the flu means helping our hospital system not be overwhelmed this season. And as I mentioned, Thanksgiving is an important holiday for many. It has meant showing our love and appreciation for our families and our friends and other loved ones with food and fellowship. This year, showing that love and appreciation and gratitude will need to look a little different in order to reduce the risk and continue to protect our families, friends, and neighbors. First and foremost, we recommend that you limit your interactions, including reducing your Thanksgiving festivities to only those in your immediate household. The best way to reduce your risk and the risk to others is to limit your travel and limit your physical contact with people who do not live in your household. I know that this is hard. What I'm asking you to do is really hard. I haven't seen my own family in Virginia or my grandmother since February, and as much as I would love to see her and travel to Virginia and enjoy her chicken and dumplings, I will not be going. She is well into her 70s, and the risk is just not worth it. And so I am choosing to show her my love and appreciation and gratitude by protecting her this Thanksgiving. If you are choosing to hold a family get-together or plan to travel for the holidays, we ask that you please take the following precautions to reduce the spread of virus. Remember that the current executive order limits indoor get-togethers to 10 people. Outdoor gatherings carry less risk, but not zero risk. Whether indoor or outdoor, follow the social distancing guidance. That may seem odd, but just because you know someone doesn't mean that you are not at risk at catching or spreading the virus. So please practice the 3 W's, indoors and outdoors. Consider alternatives for family members that are in high-risk groups, like dropping your favorite dish off at their door or virtual greetings. Please ask guests to quarantine prior to attending the gathering to reduce risk to you and others. And please consider getting tested 3 to 4 days prior to travel or attending a holiday get-together. This is different guidance than usual, so this is a harm reduction guidance that we are recommending. Knowing your status ahead of time may mean that you can protect your members, the members of your family who are at highest risk for serious illness. But please remember, a negative test does not mean that you are out of the woods. That doesn't mean you can't or shouldn't be doing the 3 W's. A negative test gives you information for that particular time. But even if you receive a negative test, you should still practice the 3 W's when meeting with people outside your household. And if you are visiting us from out of town, please adhere to the current precautions. We are an awesome place to visit, but frequenting spaces like restaurants and bars pose greater risk for exposure and spread. This may mean that you are spreading virus to your friends and family, some of whom might be at higher risk. And then please also consider self-quarantining after attending a Thanksgiving get-together. I've been your public health director now for 3 months, and I've seen how Buncombe can commit to turning trends and flattening our curve. I know we can do this. It is not the time to let our guard down. Please help us stop the spread this holiday and every day after. Please practice the 3 W's every day, every time. Please limit your interactions this holiday and consider alternatives to your traditional activities. Limit your travel and follow the mass gathering guidance of no more than 10 people at an indoor get-together. If you are choosing higher risk activities like an indoor family gathering or traveling, consider getting tested prior to that event. You can find testing sites on buncombeready.org or find my testing site website. And always, if you are experiencing symptoms now or in the future, get tested and then stay at home until you receive your results and get further instructions. we can do this. So thank you for helping us to stop the spread of COVID-19. We need every community member to commit. And just a couple of final reminders of some events of interest. There's a pop-up testing site on Patton Avenue tonight from 6 to 10. If you have concerns about establishments that are not following current executive orders, you can call the Ready team to log in your complaints. And Health and Human Services is offering a walk-up flu shot clinic on November 18th from 1 to 4 at 40 Cox. And lastly, I just want to say that Buncombe County Health and Human Services will be pushing out this Thanksgiving guide with further information on how to reduce your risk during the holidays. And so thanks to our comms team for putting that together. And that's all I have for today.
All right, thank you. Commissioners, are there any questions?
I'd like to ask a question if I could.
Yeah.
About the cluster at the prison. So you said that our numbers increasing, there is that cluster, but it's not the big calls of it going up. But those guys, the people in the prison, do we count them toward our numbers, or do they go toward, because they're in here, they don't go to their county that they're from?
No, this is considered their county of residence. And so while not solely responsible for the total increase, it's significant. It's a cluster. It'll show up on the state report by the end of the week.
Is that same with the nursing home as well? Because this is
That
the-
same
even
report
though
as the
they're from a
nursing home.
different
That's
county-
correct.
Oh, okay, okay.
Same rationale as the nursing homes, that because that's a congregate living facility, that is considered their county of residence.
Okay.
Thank you for the question.
So how much of the let me turn this on, sorry. How much of the 119 did that affect?
So the 119 is a metric based on all the cases that came in that week. So over the last 3 days, we've had an average of 60 new cases per day since Sunday. I think Sunday it was about 64, Monday another 60, and then today 60 new cases per day. The current cluster at the prison is roughly 40 inmates.
So I guess one other question I have is, these are pretty steep increases in our numbers of the last week. We're still below the 5% positivity rate, which is good. We've been below 5% throughout most of this whole process. And I guess I just, understanding there's a couple of these hot spots, but across the country, just the growth in numbers have just been like, I probably all remember 5 or 6 weeks ago when Fauci said, we could look at we could potentially have 100,000 cases a day. And I remember when I heard that on the radio, I was like, that's crazy, right? Like how could we get to 100,000 cases a day? And then we just have blown past that, so we're way past that. And it's, it's the growth of the cases around the country is just unlike anything we've seen throughout this whole process. Even the early days when it was spreading in the community and people didn't even know it yet, right? So people weren't doing weren't able to take any kind of steps to protect themselves. So fortunately, North Carolina and Buncombe County have been lower in our case counts than a lot of these other parts of the country. Like Tennessee next door has really high numbers, and of course the Midwest is, as the map showed, is just really disturbing. But do we have any sense of whether just, when we look at 1 week and the numbers are not what we want to see, but whether, we think there's a good probability that unfortunately Buncombe County is, that upward trend is likely to continue, or whether, we might be here in a week or two and our numbers have shifted back down? Just, I don't know, I guess how predictive of like the coming weeks is the data we have, or is that just unfortunately mostly speculation?
It's a great question. So forecasting is really hard because most of the metrics are based on real-time data. So the best that you can do is start to look at what we do here, which is monitor it daily through the public health department, set up key metrics that you're following, and looking for any spikes or any types of trends that show you accelerating in one way or another. And beyond that, it's quite hard to predict, other than to say that we knew as we entered colder months that folks would be spending more time indoors. We knew that holidays would be a challenge because those are traditionally times when people want to get together. And I think that we're seeing that most certainly now. And we'll likely see, based on what choices people make during the holidays, we are likely to see cases continue to increase through the state and in the nation.
So if you look at the map, I mean, what jumps out to me at the map is how well we're doing in western North Carolina. When I look at the map, if you blow the map up and you see in that little corner of North Carolina, you see the light color, which I keep saying this, and I'm going to keep saying it. It's a testament to the people that live here, that are listening, that are doing the right things, that are not, panicking during this time. They want to be able to spend time with their family and friends, but they can do it in a way that's safe. And I continue to look at that and be encouraged by that, because it's nice to see a little light spot in that national map. And I think during this time, people need to be very cautious. They need to be careful, but they also need to be encouraged about, how people in western North Carolina are dealing with this. So that's my take on it when I look at a map. You can't not look at the entire picture if there's some positivity in that map, and there is here. However, as you say, we're going into a season where we know people are going to get together. So we're just going to have to be careful.
If we want to stay that bright spot on that map, we have to commit and further commit.
Yeah, I don't think anybody wants that white spot to turn red.
Right.
I think everybody that's listening does. And I think that a lot of people have, I'm hearing conversations about how they're going to get together. They're already thinking about this, even before we give them the information. So thinking about how they can do it safely and how they're not going to be able to go, as you said, to Virginia. So, but I think we need to pull out and look at all the information and make sure that people understand that they are doing a good job, and they need to keep it up.
Thank you. Yeah, we have to keep that up. It's important now not to let that guard down. Wearing our face covering matters. Keeping 6 feet from each other matters. Making sure we continue to wash our hands and limiting our interactions.
All right, commissioners, other questions? Any other questions?
I got one more, sir, if I could.
Yes, sir.
So you're saying that our uptick is because of small gatherings? I'll have a question with do we see any from the restaurants when we're going in and eating? Do we see any there?
We don't have any current clusters due to that.
Okay.
So, it's not uncommon to have a onesie-twosie type of case that is part of a work site that happens to be a restaurant or happens to be a bar. But overwhelming, like when we look at the contact tracing and when our communicable disease nurses are doing the case investigation and contact tracing pieces, what we find about the spread and the exposure, it tends to be family get-togethers. It tends to be neighborhood types of things. It is work sites, but not necessarily all restaurant or all bar.
So when, of the number of cases that are documented as positive cases in our region, can you tell us, and if you don't have the exact number, I understand, but just what percentage of the positive cases that are documented through testing are we able to, with high confidence, identify where the person contracted COVID?
That's a great question. So I can give you a general answer. I do not have a specific sort of like concrete, what does it look like here. I can tell you early on that was much easier. When community spread was less, transmission was less, it was much easier to track exactly where or exactly what person gave you coronavirus, right? That becomes harder, not completely difficult, I mean, not completely that you can't do it, but it becomes harder as we've moved through our phases, as we've interacted more, and that we may be in lots of different places that we weren't necessarily in, say, in March and April. And again, I know I sound like a broken record, but that's why it is so important that we continue to do the 3 Ws, even with people we know. I think what comes across anecdotally in our contact tracing is that folks have a false sense of security when they're around folks they know, and that if this is sort of my neighborhood or if this is my church or, you know, whatever place that you're in, that you feel that this is part of your community, that you let your guard down and we start to get within 6 feet. We don't wear our face covering. We don't wash our hands. And so it's very important for folks to remember that those 3 Ws have to be all the time, every time, even if you have known that person for the last 20 years of your life, you have no idea where they went the last 3 or 4 days of that week.
Would it be possible, I mean, because this is all, we do keep track of this, right? Like through the course of the pandemic, like when we do tracing, where it is possible to identify what the source, we, with some level of confidence, believe it was. I mean, would it be possible to try to summarize that data in some way? Because, I mean, this is sort of one of the things throughout this whole process I've really just felt like I want to understand. I mean, and I understand, look, I mean, it's, as you point out, anytime you're spending more than a few minutes in close proximity to someone else, there's some chance, like it's just a statistical chance, right, that you could be transmitting or getting infected with COVID. So it's any kind of, you know, especially indoor, you know, environments like that create that high probability. But as we think about the different kinds of activities that are sort of most conducive to where COVID could be transmitted, are we just able to learn from having gone through this? Like, you know, as an example of like indoor dining, it's one of the things that we were all concerned about, but we also understand the importance of the you know, restaurants to the economy and how many people are employed in it. So, but as just one example, is there any way to get a sense for that sector and other types of places of the people who've gotten it? Here's how many probably got it in this kind of setting, probably got it in this kind of setting, probably got it in this kind of setting, or...
Yeah, so that data exists somewhat, and so in a weekly report that is published by North Carolina DHHS, the cluster report is an aggregate report. So you have 3 different types of cluster reports or outbreak reports that the state does as all 100 counties. One is schools and child care centers. One is long-term care facilities, nursing facility types, and then the third one is the aggregate cluster report, which is all those other types of spaces that aren't necessarily regulated by the state, like a school or a child care center or a long-term care facility. And so that cluster report pulls all of the reports that each one of our health departments is putting into the state system and creates exactly what you're talking about, those themes, those trends, and you can watch that over time. And so I'll be glad to share that with you. I don't have it with me right now, but it clearly divides it out into things like, you know, your bars and restaurants, your other community sectors like places of worship, government services, those types of places. I think what you're asking for is for each individual who is then a confirmed positive, is there a way to pull that data out where their known source of exposure was? And I think that's probably much more difficult at a local level to do based on maybe not so much early on where we had less transmission, but probably harder as case investigations have gotten much more complicated and folks are moving around a lot more. So it could have been a couple of different places where they got exposed, and they may not know exactly if someone was sick when they were interacting with them. And so it's harder to know that as the pandemic has gone on, as community transmission is increased and people are moving about more.
So, and I'm certainly, I mean, I 100% endorse everything you said about the holidays, and, you know, let's everyone do what we need to do this holiday so that we all can celebrate the holidays to come, like when we are beyond this pandemic, which is hopefully not that far in the future. So I'm all for that, and urge people to, you know, listen. But I also just wonder, like when we say that most of the growth of the spread is in small family gatherings, I mean, how do you know that? I mean, if you don't know what percentage came from people eating in indoor restaurants, which seems like a perfect environment. You know, people can't wear a mask and sit in a restaurant and eat. And even if you spread the tables out some, there's many studies that show you know, if you sit there in a restaurant, if there's someone in that restaurant with COVID-19 and they sit there for an hour, they're probably going to make other people around them sick, right? So how do we know it's more family gatherings than that?
So that's through the case investigation piece. So when someone's interviewed, they tell that communicable disease nurse all the places they've been, who else has been sick around them. So somebody in their family may have had symptoms, never got tested, thought it was a cold, thought it was allergies, and then the whole house or several members of the household then get infected, right? And so when they get tested, they get their positive result back. This is just sort of a theoretical example, but communicable disease nurse would then contact them, do the case investigation. They talk through everything that's been going on. They say, has anybody in your, you know, where have you been? What places have you gone to? Because that helps us realize too, like where else do we need to look to tell close contacts to quarantine? But in addition, through the case investigation, you learn about where their possible modes of exposure were, and also what possible modes of spread that particular case may be responsible for as well. And so it's usually through the case investigation. And so like I said, you know, folks may mention several different places, but when we hear when we hear in a case investigation interview someone say, well, yeah, I've gone to, hypothetically, went to indoor dining, or I went to the store to pick up groceries. Oh, and my mom has had a cough for about 5 days. And so, you know, there's clearly, you know, or we went to my aunt's house and had dinner, and my cousin had the sniffles and was coughing a lot. So there are some of those types of things where we're like, that could be what we're looking at, right? And so over time, as I said, that it's a little bit harder to pinpoint exact modes of exposure because of the folks moving around so much. In the earlier days, it was much easier to sort of pinpoint a place or a person of source of exposure or source of infection.
Okay. All right.
I mean, I think it's a valid, you know, question, Chairman. It's one that's kind of frustrated me a little bit over time where, you know, you're trying to pinpoint. And, I mean, if you come to my house now, I mean, we got leaves all over the place. So if I did end up getting it, I'm probably going to tell you that everybody in my house is coughing, you know, but it's not COVID related. You know, I know specifically what's causing that. So I think we just have to give like we're doing, giving the good guidance. People need to be careful. I mean, that's what I hear. Well, so-and-so was at, I mean, you traveled or you went to a neighbor's house and you know, we're thinking we got it from them, but they got it somewhere else. Where did they get it from? You know, did they had to get it outside that house? You know, but then eventually we're going to gather together, and so we just have to be really careful. But thanks for the information, as always. It's good to see it.
Is there any indication in terms of how asymptomatic folks are contributing to the spread? I think that would make obviously harder for contact tracing, but is there any idea of how that's impacting our numbers and tracing?
Yeah, and I wish I had the scholarly data with me to share with you. I don't, but we do know that not just asymptomatic, but pre-symptomatic, those folks who might show symptoms later on, but aren't at the time that they're interacting with others and potentially shedding virus, is significant, and that we've seen that over time with COVID. And that yes, it's hard to pin that down necessarily in case investigation and contact tracing when folks are also talking about where they've been, and you ask them about, have you been around anybody with symptoms, and they say no, and it could likely be that they've also been in contact with someone who is either pre-symptomatic or asymptomatic, and that's not uncommon either in our case investigation findings.
So the last slide you had, and I'm going to say this and I'm going to hush, but it's a really good slide, the Thanksgiving 2020 safety tips. I mean, if you look at the slide before where you were talking about, self-quarantining after you have a Thanksgiving gathering, and I would read that and I would think, okay, well then that means after I have Thanksgiving dinner, I got to stay at the house for 14 days, which that's not what you're saying, right?
For the guidance that
I
I
might
talked
eat
about?
enough on Thanksgiving to where I might have to do that, but this, if you read all of these are very good, and they need to be put out there. I mean, because these are very common sense things that you can do. They're not fearful at all. They're very common sense things: low risk, medium risk, high risk. And so I think it'd be, people need to be able to see that. They need to be able to read that. We need to get it out to them. If they're looking for, for some guidance, that's some good common sense. That's a good common sense approach, I think, on that slide.
Well, thank you. I cannot take credit for it. That is our very competent and incredible communications team who are not in this room to take credit for that, but it will be pushed out. I believe it's going to be pushed out today after this briefing, and will be on our website for folks to access. And North Carolina Department of Health and Human Services also has some interim Thanksgiving guidance and guidance around Black Friday shopping as well, if folks are interested, and you can Google that. And I'm sure we have a link to that at some point too.
All right. Thank you so much. All right. Appreciate it.
Thank you.
All right. Next up is the transparency update, and Matthew Baker is going to help us with this item.
Good afternoon, Commissioners.
Good afternoon.
So back in 2017, the board issued a directive to align county operations along 4 core values, and one of those values was transparency. So from that directive, the transparency initiative was undertaken. We set up a site and some dashboards, and those were designed to answer some pressing questions from the public. Here we are 3 years later, and although the county's dedication to transparency has not changed, what has changed is how we manage that. We now have a transparency work group, which is cross-departmental. We have procedures, processes, audit checks in place that weren't there before. The goal is to ensure that the county is putting out reliable and interactive content that is of genuine public interest and that is built in the most efficient method possible. In so doing, we hope to increase our engagement with citizens and answer their most pressing questions in a way that reduces strain on staff and ultimately saves tax dollars. We have 2 platforms that I want to discuss, our transparency site and the Open Data Explorer, but I wanted to briefly start by talking about the key differences between the two. While this isn't far from an exhaustive list, it does encapsulate the primary differences in the 2 approaches. To start with, you have, as a major difference between the 2, is a finished product versus an unfinished product. The transparency site is offering completed visuals to answer a specific question, while the Open Data Explorer allows citizens to take data sets and to find the answer to a question they wish to pose. The transparency site's guiding principle is proactive disclosure, by which I mean publishing data for the masses rather than waiting for an individual public records request to come in, or as happens in a lot of cases, yet another public records request to come in. On the open data side, the primary goal is to achieve legal and technical openness, which is defined as free access for use and reuse of data, as well as that data being available in bulk for download and machine readable in multiple formats or in a universal format. The transparency site itself is a collection of reports, dashboards that are intended to answer specific questions like I mentioned. As such, the data used are predefined interactive visuals that we hope are accessible and easy to understand. That site might not look drastically different from what you're already familiar with. However, we have made significant changes under the hood. Those would include layout and navigation improvements, refined update strategies, a content audit trail, and better site metrics. Those are components that we were missing initially. One of the first items we accomplished was creating a framework for disseminating transparency data. This is the 10,000-foot level, but if you'd like a more comprehensive view of the process, I can make that available to you. We've standardized the request process through the county's service management platform. This allows us to track and respond to items as they are submitted, and having that audit trail is one of the most important items that we've established. Items that come through the work group go through a compliance process that includes approvals from legal, risk, and IT security, and nothing that comes through the transparency work group gets published without those approvals. The content then enters an agile development cycle, which means we just iterate over and over and over until we get to the desired product and get the approvals that we need. And from there, a promotion plan is enacted by the communications and public engagement team that coincides with publication. The Open Data Explorer is an ArcGIS platform that is useful for exploring and downloading Buncombe County data. It's for internal and external use, honestly. Currently, the site has over 158 data sets, and the data are set out in tables. Maps are also available if the data set supports that kind of data. It's free to use. There is no registration or licensing involved. The data is downloadable and, for more tech-savvy citizens, consumable via an application programming interface or API. We certainly invite the community to explore it and let us know where we can improve, and to do so, just visit data.buncombecounty.org. And the process for publishing data sets to the Open Data Explorer is virtually identical to the other transparency content, with only the development cycle being a lot more concise, since we're not developing visuals and other finished types of products. And there really isn't a promotion component involved in that. I would like to note that the county is in the process of developing a policy on open data that takes into consideration best practices for local government and some citizen concerns into account. We're hoping to have that policy ready by the end of the calendar year. So briefly, I did want to get into some metrics and show a little bit of the payoff for our efforts. Just for the record, the county does not know who is visiting our site, just know that it was visited by individual users. Our metrics show that we are now attracting more new users than previously. It's a modest 5% increase, but directionally that is definitely the way we want to go. And since we've put our changes into practice, we've seen a 42% drop in our homepage bounce rate, which is probably a meaningless thing to say. However, what it means is that when folks come to our site to look at something, they're not then immediately leaving. What they're doing is they're now browsing the site, looking at other content and exploring it more fully. It's we think, primarily due to two changes that we made early on, which is working with communications and public engagement to promote in a sustained fashion transparency content, but also in the way that we have increased our presence within search results, which is the primary way which folks navigate the internet. We still have a lot of work to do in terms of content promotion, but we are making some strides. And one note on these statistics, they do not include any items related to COVID-19. The reason why those are excluded is because of the interest in COVID is so high, these results would have been incredibly skewed. For reference, while we're getting around 5,800 unique page views for the transparency site, which I would like to stress is a very good number, it would be very misleading to show you those numbers with COVID case information in there. And that would be why. So this is the COVID dashboard metrics. We're looking at closer to a quarter million unique page views. And the only reason I'm really showing this is that While the COVID-19 dashboard, for instance, was not an item that came through the transparency work group, many of the resources normally dedicated to transparency content have been engaged in providing the county with data support for items like this, and also the data consumed by the Emergency Operations Center. As such, it's really slowed our progress in terms of less publication of items than was originally intended. That's not a complaint, it's just a fact. So I did want to briefly mention what doesn't get published. Data that is protected or sensitive is not something that we publish. Again, that's kind of ferreted out during the compliance process. Data with questionable integrity, data that's not clean enough to find any kind of use, or data that we are unsure of its pedigree does not get put into the Open Data Explorer. And data from other entities. The lone exception to this might be a third party with whom we have a data sharing agreement, an explicit data sharing agreement. Otherwise, we are not in the business of putting other folks' data on our website. What I'm hoping that you can take away from this is that the county is dedicated to using best practices in data for local governments, and hoping to answer the citizens' questions in a way that is flexible to their needs while also being judicious stewards of their dollars. And that's all I have.
All right, thank you very much. Commissioners, do you have any questions at this time? Thank you very much. We appreciate it.
Pleasure.
All right, next up is the Upward Mobility Grant. And Rachel is here to talk to us about this item.
Good afternoon, Commissioners. I am
Afternoon.
here this afternoon to speak with you about a grant opportunity called Upward Mobility Cohort. I always introduce myself in case there are others listening, even though we know one another well. I'm Rachel Nygaard, and I lead the Strategic Partnerships Office for the county. And I'm here with you today representing a group that's been working together on the grant that includes Health and Human Services, Communications and Public Engagement, Performance Management, to name a few. So the Upward Mobility Cohort is an initiative focused on what it sounds like, upward mobility, specifically mobility from poverty. It's a grant opportunity from the Urban Institute, which initiated with funding from the Gates Foundation, a partnership that they've done with the U.S. Partnership on Mobility from Poverty. This is a grant opportunity which would include an award of $125,000. Up to 8 counties across the country will be selected to participate in the cohort, and Buncombe County is one of 26 counties that have been selected as a finalist. We submitted an application response to the RFI, or the initial request for information that had, we submitted that in September and heard back in October that we have been selected. Keeping good company with this list of other counties across the country, including one other county in North Carolina, which is Orange County. A little bit more about what the grant entails. Funding from this grant, that $125,000, can be used for a grant-funded position. That's helpful to know. Anytime that we're looking at a grant which has a potential to bring on new work with it, having a position dedicated to coordinating that work is important. And it involves the crux of the grant involves a lot of data analysis as well as community engagement. We would have policy and programming advising, and I'll talk a little bit more about what that means in a minute, from the Urban Institute, as well as connection to those peers. It's referred to as a cohort, so if we were accepted, we would be among that 8 county group learning together, and we would have both a mobility coalition and a mobility action plan. The mobility action plan looks at data, and we'll talk about what kind of data in a sec, and uses our engagement with stakeholders, meaning partner institutions, community-based organizations, as well as members of the public at large, to look at mobility as defined. We'll look at how it's defined, and the specific drivers and how our data in Buncombe County compares to data for other communities across the state and nation, and strategies that could potentially improve conditions that are tied to those drivers that would ultimately help with mobility from poverty. So upward mobility, for the definition on this grant, is what you think of when you think about economic mobility. It's that economic success. Anyone with talent and hard work can advance their position in society, but this particular definition draws on some research that shows that it's not only economic opportunity alone, that these other factors like being valued in community and having power and autonomy over one's life also contribute. That if you've got that sense of belonging and you've got that ability to control your own circumstances and have influence on the policies and practices that impact your life, that you're more likely to have that economic mobility. This is a pretty data and research-driven initiative, and the materials articulate some drivers. So looking at those areas, economic success, value, power and autonomy, they've tied those to different domains and drivers. Those same items, as we start looking at this list, you'll see familiarity to the kinds of items that we've included in our strategic plan. So looking at financial well-being, looking at housing and family and health, as well as data that falls into the supportive communities and strong and healthy families categories. So each of these breaks down to metrics that we've been provided a set of data for Buncombe County and that we can analyze, and that if selected for the cohort, we would be using as the basis for studying and coming up with a mobility action plan for Buncombe County. If it feels like it's another plan, we've certainly been having that conversation. It feels like everywhere we look within Buncombe County and as an organization and within Buncombe County as a community, we've got plans underway. Us as an organization, we've got a new strategic plan that we're less than 6 months into implementing. We've got an equity action plan that is in development that we've committed to our community that we would create as a part of that strategic plan. We've got community health improvement plans that look at health conditions and the health of people in our community. The Board of Commissioners passed the reparations resolution, which commits to establishing a reparations commission and coming up with plans and suggestions on how to advance improvements in that area. We are on the heels of doing a comprehensive land use plan, economic development, library master planning. We could go on and on about the plans, and so we were careful in thinking about this grant opportunity about whether or not it would be additive, and we do feel that this opportunity is in such alignment with those existing commitments that this may reveal ways that we can make good on those existing commitments into our community. So back to that strategic plan, first one on the list, we've made commitments to increase the average wage and to address affordable housing and things like that. And so hopefully, if selected, the strategies that would come out of this would help us advance and align with the goals in all of those other plans. So that's an overview, quick check-in on where we are in the process. The application is due to Urban Institute by next Tuesday, November 24th, and we would hear sometime in December and get rolling with the funding period beginning in January 2021, and it would be an 18-month, a year-and-a-half grant. One of the reasons it's important that we're checking in with you at this stage of the application process is that the application requires a letter of support from a member of the board affirming commitment to this project and its continuity for the period of performance. So want to check in with the full board in an opportunity where you can weigh in and ask questions and have discussion on that before we were to go to the chairman and ask for a letter of support.
All right, thank you, Rachel. Are there any questions from any commissioners? Thank you very much. I don't think there's any questions at this time, so thanks for outlining the process and the plans for going forward. So look
Very
forward to
good.
hearing more.
You're welcome.
So Commissioner, we will bring a letter for you to sign then? Okay.
Great, thank
thanks.
you. All right, commissioners, the one other item I wanted to just touch on is the public comment for our meeting at 5. So we haven't had a lot lately, the last few meetings, but we have quite a bit of folks who are interested in giving public comment at the meeting tonight. We've got, let's see, a couple on sort of noise issues that they wanted to comment about. We've got about 4 on the family leave, but then we have over 30 on the Pratt and Whitney item. So, and Lamar, these are all folks that we're going to listen to. Either they're going to be a live call, or in some cases they've sent an email or have left a voicemail, which we will listen to, correct?
They should all be live calls.
So the folks who have left messages or emailed, what do we do with those?
We're gonna call them back.
Okay, we're gonna call them.
So they
Okay.
have registered, and they, in registration, you have the ability to kind of put your comments and what the discussion item is. So in some cases, they have actually put a little bit more wording in just what they tentatively want to discuss. So that's why you see
Okay.
a little bit more information there.
Okay, but for this, but based on what you've heard, you anticipate we have about 30 on the Pratt and Whitney item, or thereabouts. They've indicated that's what they're interested in. So, and each of those, we'll give 3 minutes for each person who's going to be on the phone, right?
Yes.
Okay, so not every person will use the full 3 minutes. I just wanted to kind of surface this because we have over 30. You know, if every person did use 3 minutes, that would be an hour and a half there, not counting any transition time between calls, of which, of course, there will be some. So it could certainly go over an hour, I think. I think in some of our previous discussions, we have talked about possibly taking comments for up to an hour. So I just wanted to let folks know what we got and see if there were any feedback. I mean, I guess my inclination is just to, just follow the process. It might go over an hour, but any thoughts on this?
I think we need to look at the presentations we're taking tonight. Jerry V. Hahn, Chuck Edwards is coming, and they've got a busy schedule. Jerry's got a meeting with Woodfin that he's got to get to, so could we maybe push that up on the agenda early to do the recognitions instead of waiting until 6 o'clock and them having to leave before they can do their presentation?
Well, I think most of the comments are for public hearings, and they would be after the general comments and after the presentations. Yeah. So the presentations would come before, so they would be able to present before we get in the meat and potatoes of the public comments.
So we're not, so
Okay.
we wouldn't be doing them at 5 o'clock then?
Or
Correct.
5:15?
We would do the general public comments. We could do the general public comments at 5:15, which we have previously discussed and decided upon. And then for the public hearing, we would do those calls during the public after we hear the public hearing
And there'll be
information.
2 of those, one for the
Yeah.
family leave, one
Okay.
for Pratt and Whitney.
Right.
Okay, great. Well, that works out just fine then.
Okay, but did you not say we had 5 that
No,
was?
for general public comment, I think there's just 2.
2, so
I think we
okay.
should just probably knock those out. They'll be short, I think.
Yeah, they can't be no more than 3 minutes.
Okay.
Yeah,
No
so
more
I
than
think
We've
we
got
can,
the two.
6 minutes, yeah.
we can do those. It shouldn't take long. I was worried about the big groups, but we'll do those after the recognitions
'cause
during the
they'll
public
be out.
hearings. Okay.
Robert, you mentioned something about the order on those presentations because
Oh.
of some scheduling?
Yeah, Jerry Vihan has his town meeting at, I think, 6 o'clock, so wanted to make sure we got him out in time.
So
Commissioner Pitt.
what's your recommendation on the order of the presentations?
Well, since we've got the time now, I would like to see about, doing Mike Plemons first and then Gene Bell, and then saving Anthony and Joe till last, because if someone else wanted to speak. I know we talked about it last week, but
We did
I
put
think
An-
Joe and
We did put Anthony first because.
of Jerry,
Mayor Jehan starts at 6.
right.
And our public comments is at 5:30, so if he can be out by 5:30 to get back to Woodfin, but you can change it as anyhow that you choose to.
Yeah, I mean, and leave it up to everyone else. I mean, Joe being commissioner for 8 years here, if someone else wants to say something with Anthony, being here, I think we've got the time now with the public comment that we could save them, because, I mean, not that Mike and Gene are not important. They're very important. Gene, what he's done all these years, and I know Chuck's excited about seeing him. But I'd really like to honor Joe Belcher for 8 years. And
So Robert, your recommendation is to do it in which order?
the opposite of what me and Avril talked about. Yeah.
What is that, Robert?
Be Mike Plemons first,
Yep.
Gene Bell, Anthony, and then Joe.
Okay, I think that's,
If that,
that sounds
'cause
great.
we got the time now to do that.
Yep.
Sorry.
All right. I think that's a great plan. All right, very good.
Yeah, I'm not planning on leaving early or anything, so, just, y'all do what you want to do.
Okay.
I'm gonna stick it out.
All right, I think we've got a good plan. Thank you all for helping us talk that through, make sure we're clear on how that would work. I feel good about it now. All right, y'all, we are adjourning this meeting. We will reconvene at 4 o'clock for the regularly scheduled, 5 o'clock. And let's try to be ready to go at 5 so that we can get going. All right, thanks.